Dr. Mills?
Actually, I'd like to hear from Dr. Losey because he's here tonight and he's standing right next to you because I bet he has something to say to that.
Tell us who you are, where do you live, and what is your question?
Yeah, I'm Larry Losey. I'm a pediatrician in Brunswick. And one of the things I've been concerned about is hearing all of the concern about the tremendous profits that the vaccine companies are making. And if that's so, why are so many vaccines only available from one source, and why are the number of companies making vaccines declining?
I think you're wrong about those two assertions. So first, for example, Glaxo just bought the vaccine division of Novartis. So the vaccine companies are getting larger. And in that way, there may be fewer of them, but they're certainly making many, many more vaccines and a lot more profit. I can read you the prices of a number of vaccines. To fully vaccinate a child in the United States costs well over $1,000. Okay, there you go. So yes, they're making profits. They're doing well. You may be aware that last time I looked, of the top 10 Forbes companies, 5 were pharmaceutical companies. They're not going out of business, no. The Novartis vaccine division was sold for, I think, either $3 or $5 billion. Glaxo has just announced it's going to build a huge vaccine research center, 500,000 square feet, in Rockville, Maryland. Guess what? Right next to FDA. Make the revolving door very easy.
Well, I mean, again, in other countries, it's the government that manufactures the vaccines. So, you know,
China and Russia.
We have a choice. We have private industry manufacture the vaccines with several federal agencies with oversight, or we have the government manufacture them. And I think the current system, particularly with the different research universities and healthcare systems that are involved in helping to assure that oversight and to look at vaccine safety issues, that it's a system that is working, generally working. Can it be better? Yeah, as Dr. Flanagan says, we can always improve. But it's awfully good when we see the data about how few children and how few adults get vaccine-preventable diseases in this country.
Where I was trying to come from on that was the fact that it costs hundreds of millions of dollars to develop one vaccine, and there's no guarantee that it's going to sell. Their profit margins are extremely low on vaccines, much lower than they are on the other pharmaceutical companies. I'd be glad to bring out the data and show you.
Yes, I have it right here.
And mandates apply to very few vaccines. I mean, just to be clear, that there are a number of vaccines that are recommended for children and adults, but there are very few subset of those that are actually required for attendance at school and for attendance at daycare and for some healthcare workers.
Dr. Flanagan, we haven't forgotten about you. It seems like we have. So I want to get a quick comment from you, and then I have to check in with our viewers at home and see what Jana has for us after you have your brief comment.
Well, thank you. Again, the vaccines, there are a dwindling number of manufacturers, and it's because we in America have a system that is a privately driven system. It is an entrepreneurial system. There isn't a lot of money to be made in these, and they're extremely expensive to make. Nonetheless, they continue to get better. We have gone from the 1980s, when you got your vaccines, which were fewer in number, and they had 3,000 different versions of little microscopic, we call antigens, the things that your immune system responded to. Now we're down to 130. We're able to zone in on the key parts that drive your immune system without causing the other areas of inflammation. And so we're continuing to get better on a very narrow profit margin.
A lot of great questions here running towards the end of our program, but I want to find out what our viewers think at home, and I've been told by the producer that social media is blowing up at the moment, so I think they have something they want to share with us. Jana, what's the latest?
Yeah, Mark, I'm pulling it up right now here on Twitter. Let's get right to an exchange, because the debate is happening here in our studios, but it's also happening between our viewers online. So let's pull that up on Twitter because I lost it on my page. Here it is. So Amy says parents are being discouraged from doing research about what is being put inside children. That's crazy to me. Well, a guy named Larry responded. He says, do we really want to go back to child mortality, I think is what he means, and debilitating illness rates of the 1900s? And Amy responds back and says, I'm not saying that at all. I'm saying parents should be encouraged to read scientific studies. I have a question for the panel. Dr. Mills was talking about how easy it is to opt out on those forms, how easy it is for a parent to check, no, I don't want to get my child vaccinated. There was a proposal in the Maine legislature that would make it more difficult to opt out, that if a parent wanted to opt out of a vaccine, they would have to see a doctor first. I'd like to know if the panel supports that or not.
We're vehemently opposed to it. Parents should not be forced to see a physician that they don't agree with in the first place in order to make an informed consent in medical decision making. It's discriminatory. It actually puts a greater burden now on parents who want to opt out rather than parents who get vaccinated, because parents who choose to vaccinate their kids don't have they don't have to understand anything. They don't have to go through a counseling process. The doctor can say, I recommend this. They say, yes, it's done. And it also generates paperwork that makes parents look like they are making a bad choice that can be used against parents later to say, you know, you went against medical advice and you're putting your child at risk. And it's discriminatory against parents who choose to opt out of vaccine.
I would say that a number of states have these types of laws, and what they do is they get at the issue that I mentioned earlier, which is why should it be so much easier just to check a box and say, I don't want my child to be vaccinated against these several vaccines that are required for school or daycare attendance. But it also just assures that there is a conversation that happens, and we would hope that a parent has a relationship with a healthcare provider that is one that is a healthy relationship, and not just one that is, you know, as you kind of described, as somebody just, you know, hammering the information down somebody's throat. That it is actually a more of a relationship where there's informed, shared decision making going on. But there are some important issues that need to be addressed if a child is not going to be vaccinated before they go to school. One example is that if there is an outbreak of that particular disease in the school or daycare, then the parents need to know that that child is likely going to be required to stay at home for sometimes, like for chickenpox, it can be several weeks, for instance. So they just need to know that. A lot of times what we found when I was working at the state and as a pediatrician before that parents didn't realize when they just checked the box and said, oh yeah, I won't be vaccinating my child. They didn't realize until there was an outbreak that meant that child was excluded from school, and to protect them until the outbreak was over, and sometimes that could be several weeks. So the states that have these laws simply, they don't require that the child be vaccinated in that circumstance, but just that there's a conversation with certain pieces of information that are conveyed, and that the parents can still opt out of the vaccine.
Let me say, and this is in place in California, and parents have widely reported that they can't find doctors to sign off on it because doctors don't want to give permission for parents not to vaccinate. Some of those parents will be submitting testimony to Maine on this law. The law also requires that they be counseled according to CDC guidelines. And again, I've said several times tonight, CDC is under investigation by the Department of Justice and by Congress for putting out fraudulent papers. So why should I be counseled according to CDC guidelines when I'm helping participate in this investigation?
The states that have these laws, like Washington State, for instance, has a very good one, and it actually has details of which topics need to be discussed. And then all the physician or other healthcare provider is signing off on is that those 3 topics, for instance, or 4 topics were discussed. It's not that they're giving permission.
Does the State Medical Association want doctors to participate in this? I think that's another question.
All right, I'm going to stop you there for a moment because the producer's telling me we're out of time, but I'm going to squeeze this one last question from this young lady here. So this is a lightning round question, and I have 2 30-second responses, and that's it. We're out of time. Please tell us who you are, where do you live, and what's your question?
My name is Anne-Marie Grenier, and I live in Windham, Maine. And my question is actually really straightforward. And then I would like to sort of tease out some information.
I'm out of time, so you got to get to it. Get to it.
Why does our federal government protect vaccine manufacturers from product liability lawsuits? And to that end, I want to note that taxpayers have been funding the U.S. Health and Human Service Administrations, which Ms. Taylor touched on, for the injury protection since 1989 to the tune of $3 billion. $3 billion. But also, could you touch on your legislation?
All right, we're doing less touching because we're out of time here. But I want to go with Dr. Flanagan. There is legislation. We talked about it earlier in the program. We talked about the liability protections.
So the liability.
30 seconds.
In short, the federal government assumed the liability when it passed the legislation in the 80s. It took it from the manufacturers so the manufacturers would continue to manufacture and wouldn't be at risk of going bankrupt, and the federal government assumed that risk, and now the federal government funds that, and that's what the vaccine court is for.
And the vaccine court fails most families. The Associated Press, the New York Times, the General Accounting Office, and American University have all written very critical analysis saying that vaccine-injured families are not being compensated.
Okay, and that's going to have to be the final word because we've run out of time for this evening. Tonight you heard a lot of passionate discussion, a lot of disagreement on a very emotional topic, but we hope that you at home had an opportunity to find some of the answers to the questions you may have. I think on this one issue, we're all in agreement that whatever side of the debate we're on regarding vaccinations, we want the safest, healthiest environment for our children. Now, we're continuing the discussion throughout the evening on Facebook.com/WGME13. Please log on and tell us what you think. Make certain you watch the late news for coverage of the town hall and all the day's breaking news. I'd like, on behalf of the panel, the studio audience, and the fine crew of WGME13, I'd like to thank you at home for joining us. As always, we salute our military, law enforcement, firefighters, EMTs, and other emergency personnel for the support to our communities and our nation. I'm Mark Hyman. Good night.